All right, guys, so we'll start going over the joint capsule first. We'll look in the axial projection. So looking here, the joint capsule is easiest to be seen because it's this grayish outline around the condyles. So in the axial, you're going to see it really well around the femoral condyles. You're not going to see it too well down around the tibia in the axial projection. You're kind of seeing like a smidgen of it here. But when we get into the coronal, I want you to see this gray line here and this gray line here and gray line there. That's the joint capsule. All right, and so that's what's going to surround, you can see it here anteriorly, and then as we go back posteriorly, surrounding the condyles, surrounding the tibial plateau, the posterior aspect of the tibia there. All right, so that's your joint capsule. In sagittal, you can see there's your joint capsule there around the anterior portion of the femoral condyle. You can see a little bit there on the tibial plateau, posterior condyle, okay, joint capsule on both the medial and the laterals. This is medial side, and then this is lateral side because there's the fibula. All right, so that's your joint capsule. Next thing we have to talk about is the meniscus. So since we're in a sagittal plane, I wanted to point out that the meniscus, remember, these are two C-shaped discs. So the two C's are pointing together from lateral to medial. So the two horns, remember, anterior and posterior horns of your menisci face together, and they're connected on the anterior horns by the transverse ligament. All right, so let's start lateral because it's just the closest, and I know I'm lateral because there's the fibula. So as I travel into the knee, the first meniscus you're going to see is the lateral because we're on the lateral side. And so this is like the back part of the C of the lateral meniscus. As I go into the joint, I'm now going to have the posterior and anterior portions of my C. So here's your posterior horn and your anterior horn of your lateral meniscus, posterior and lateral. It's going to look like a triangular wedge in a sagittal view. So there's your meniscus, posterior horn, anterior horn, and then remember that they're connected on the anterior side by the transverse ligament, and that's this guy right here. So no meniscus here. We're in the center and inside the actual knee joint and intracapsular right now. The transverse ligament travels across and is going to connect at the anterior horn right here of the medial meniscus. And here's the anterior horn and posterior horn of the medial meniscus. Posterior, anterior, triangle, medial meniscus, and then there's the back side of the C of the medial meniscus. So that's in a sagittal view. Coronal, again, these are the two C's sitting on this side and this side. If we go all the way anterior, there's patella. And again, I'm not going to go over a lot of bony anatomy. I'm referencing a lot of bony anatomy you should know by now. So we're not going to go over that. However, it is fair game on a test. Patella, apex of the patella right there. Traveling back posterior, here is my medial meniscus right here, okay? Medial meniscus, here's the anterior horn because I'm still in the anterior aspect of the knee. As I travel back, look at, here's my connection, my anterior connection, my transverse ligament of my medial meniscus, and there's my lateral meniscus. Here's my anterior horn of my lateral meniscus. Traveling back, I'm now on the back side of my C, back, and then now here's your posterior horn of your lateral meniscus and posterior horn of your medial meniscus, okay? So those are your meniscus or menisci and coronal. Let's look at an axial view. The axial view is where the menisci are going to look like their C, okay? Here's your C of your medial, and here's the C of your lateral, and it does kind of come over in a different slice. It's kind of oblong. So there's your lateral meniscus. Here's your medial meniscus. And what are they connected by? The transverse ligament. Okay? Anterior horn, posterior horn, anterior horn, posterior horn. Okay? Medial, lateral. How do I know this is lateral? There's your fibula. All right, so that is the menisci. Now let's talk about the ligaments. So you have extracapsular and intracapsular ligaments. Remember, extracapsular are outside of the joint capsule. The joint capsule is the central portion. It surrounds the condyles, surrounds the tibia, and then in the central portion. So what's outside of that? Okay, so in an axial view, the first thing you're going to see is the LCL right here, lateral collateral ligament, and it's going to travel over and connect in there to the epicondyle. LCL. MCL over here. Here's your MCL coming down. It travels over, and then you're just kind of missing it there. MCL is a little bit harder to see, I think. I have trouble seeing the MCL sometimes. But here I can see there's MCL, and it's kind of coming over. Switch into a coronal view. Coronal of the MCL and the LCL. It's getting a good slice. Let's look for our LCL first. And here we go. Here's LCL right here. There's your LCL, connecting your femur down to the fibula. Okay, portion of it right there, portion of it right there. MCL, again, much harder to see. Let's see, there's kind of a slight, you're kind of seeing a slice of it in here. It's in here, and then here's a slice of it in here, connecting the femur to the tibia. So in here, MCL, this blackened area, MCL. LCL, again, is right here, this black area here. Extracapsular ligaments. See, this is the joint capsule here. We're outside of the joint capsule. Joint capsule, outside. Here we are right here, outside of the joint capsule. All right, so that's your LCL and MCL. And remember, you can't see them on a sagittal. So now we want to look at the intracapsular ligaments. Let's go back to the axial. I think axial is the hardest to see. I mean, it's easy to see the ligaments, the intracapsular, because they're within the capsule of the joint space, okay, the joint capsule itself, joint capsule, joint capsule, joint capsule, inside the joint capsule. You have the anterior cruciate ligament, the intracapsular cruciate, anterior, and then posterior cruciate ligaments, okay? ACL and PCL. PCL is the meatier of the two. So if ever you're going to be a little bit confused, look for whichever one of the two is bigger, because they do kind of crisscross a little bit. The bigger one is going to be the PCL. So right here, this is your PCL. All right, here's a nice cross section of the PCL. Here's a little kind of tangential of the ACL. PCL right here. PCL coming down. You can't quite see where it connects to the intercondylar eminence. Coming up, PCL, PCL, right there. PCL attaching to the medial femoral condyle. Here's the medial femoral condyle. It's kind of attaching right in here on the medial side. ACL over here, this guy. ACL attaches from the lateral femoral condyle, so right here, lateral femoral condyle to the intercondylar eminence, down here, down. Here's your intercondylar eminence down here. These are the eminence here, coming up, up there to your lateral condyle. All right, so that's in an axial view. Coronal view, again, look for the meatier one. Here's the meatier one. That's your PCL. PCL right there. Look at that big guy attaching in. Okay, PCL, 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 PCL. Medial condyle, ending of the PCL. So now let's look for ACLs right here. This guy. Lateral condyle. Here's the insertion there. Coming down, down, down to your intercondylar eminence. So much smaller, the ACL, than the PCL. Look at this meaty guy. Okay, PCL, PCL, PCL. All right, that's in coronal. And then last but not least, in sagittal. Sagittal is the easiest to see. They kind of crisscross, kind of like an X. Criss-cross right there. Big guy, look at this big meaty guy right here. PCL right there. Big guy. Okay, ACL, meh, this little guy right here. Okay, So PCL, ACL. So now you guys have a little bit better of an understanding of these ligaments inside the joint space. And when you talk about people that have meniscal tears or loose bodies in their joint space, or they have a tear of their PCL, now you see why a PCL tear would be bad. Now you see why it's not as common to get a PCL tear, because that guy's big, juicy, and meaty. But the ACL, it's kind of teeny, right? ACL tear, so common. ACL strain, so common. Why? Because it's this little guy right here. Okay, ACL and PCL. And the ACL is the one thing that's stopping hyperextension, okay? Hyperextension of your knee. Very common thing to happen, especially in football, right? Hyperextending your knee. And this is the only guy preventing that. So you can see why that would be an easy thing to injure. All right, last but not least, we have the gastrocnemius muscle. Gastrocnemius, the two heads of the gastrocnemius muscle come together to form the main part of what we would call the calf muscle, the definition or the defining look of what the calf muscle looks like. And then underneath that, just under the gastrocnemius, is the soleus. So remember, the two heads of the gastrocnemius, the medial and lateral head, come together, and then underneath that is the soleus, come together and form the two tendons from the gastrocnemius tendon and the soleus tendon come together to form the Achilles tendon that attaches down at the calcaneal tuberosity. So here I want you to see, if we start on the lateral aspect, this guy right here attaching up to the femur, that's the lateral head of the gastrocnemius muscle. Going medial, looking at the kind of the same thing, this is the medial head of the gastrocnemius muscle. Okay, so that's in the sagittal view. And again, they come down together like the picture in your notes to form the definitive look of what we know to be the calf muscle. Switching over to the coronal, going all the way posterior. Okay, here's your two heads right here. Lateral head, medial head of your gastrocnemius. And if you follow them down, they come together here. Medial, lateral, gastrocnemius. And then soleus, if we were to cut these and pull this up, the soleus would be just underneath that. And if you follow all the way down, eventually they both taper down into a tendon, and then the gastrocnemius and soleus tendon combine to form the Achilles tendon. Axial, go all the way up. Here's your two heads, okay? Here's your lateral head and your medial head of your gastrocnemius, and then you can follow them all the way down, and there's your calf muscle right there. Okay, so there you have it. That's your knee and all the stuff you need to know for the knee. Again, I'm not reviewing a lot of bony anatomy. I did reference it throughout. It is fair game for a test.